This is Dr. Sylvia. Today I'm going to talk about hyperpigmentation. Pigmentation or hyperpigmentation is a very common skin condition. For most of us, this happens because of UV or sun exposure, leading to freckles or sunspots or lentigines. Sometimes it can be from an irritation known as post-inflammatory hyperpigmentation. But also, particularly in women above the age of 30, we may develop brown patches all over the face. This is known as melasma. This is a type of patchy pigmentation that typically also touches the junction between the top two layers of the skin, and this is what makes it most challenging to treat. First, it's important to understand which of these pigmentation affects your skin. Sometimes the treatments that we use may actually irritate some other forms of pigmentation, such as with laser procedures. Sometimes they can irritate and result in worsening melasma. Now let's talk about the different types of pigmentation. Epidermal pigmentation means that the spots are on the surface of the skin. Examples are freckles, sunspots or lentigines, and also post-inflammatory hyperpigmentation, or pigmentation that happens after an inflammation like pimple. These are generally a little bit easier to manage because they are on the surface of the skin. In contrast, a deeper pigmentation is a pigmentation known as melasma. This generally results from hormone changes, which could be from taking the pill, having been pregnant, with menopause, or even just experiencing stress. Because melasma is a little bit deeper, it's much more challenging to manage. Melasma is notoriously difficult to treat. In fact, it has a high rate of recurrence. Although you may not have symptoms with melasma, it can be disfiguring. Often we just say it's pigmentation, it's easy to cover with makeup, but actually clinical studies show that the presence of melasma is associated with severe psychological consequences. These include anxiety, depression, loss of self-esteem, and poor body image. In one study, low self-esteem was seen in 43% of patients with melasma. Now let's talk about what we can do. The assessment is critical because some treatments may end up darkening melasma if this is present. We need to check the type of pigment using computerized skin analysis to properly identify the level of your pigmentation. We then talk about clinical options with you, allowing us together to make an informed decision about the right treatment for your type of pigmentation. In general, there are several treatment options. First, we may prescribe a prescription-grade skincare that can reduce pigmentation and block melanin production. The most effective of these are not over-the-counter skincare. Often they contain hydroquinone, which remains as the mainstay of melasma and pigmentation management. One important point: lightening creams do not lighten or whiten you. These merely even out skin color by diminishing darker spots and blotches like freckles, age spots, and melasma. The active ingredient hydroquinone works inside the melanocytes by decreasing the action of an enzyme known as tyrosinase, which is important for the creation of melanin. Sometimes we use chemical peels and skin depigmentation treatments. Chemical peels, like the name suggests, sloughs off superficial layers of the skin in order to lighten freckles and age spots on the face and the body, to give you a more youthful glow. We also use a type of peel known as the Vitality Peel or VI peel from the United States. This is a special chemical peel that uses a combination of acids and antioxidants to improve skin tone and texture. They contain vitamin C, AHA, and BHA to gently remove superficial pigments such as freckles or age spots with minimal downtime. Sometimes we use lasers and light treatments when appropriate to effectively reduce pigmentation in the epidermal layer. An example of a light treatment is our Limelight Photofacial from the United States. This is an FDA-approved, time-tested intense pulse light or IPL technology, What it does is it draws the brown spots to the surface, it has pinpoint scabbing, and then it makes the skin cleaner after 7 days when the scabs fall off. Another type of laser that we do for pigmentation, when appropriate, is laser skin resurfacing. The one we use is from the US and known as the Pearl. The Pearl, as the name suggests, peels off the damaged skin on the surface, including the pigmentation, and replaces you with new skin that has a pearly glow. Not only does Pearl reduce pigmentation, it reduces fine lines, sun damage, issues with your texture, pores, and superficial acne scars. Finally, there are newer developments in the management of melasma. One oral medication, known as tranexamic acid, which is actually a medication that we've used for years for another application, has been shown in clinical studies to improve melasma that is difficult to manage. Tranexamic acid is a procoagulant. It makes you stop bleeding. And so the original application of tranexamic acid is for people with extensive menstrual bleeding, or in those with a bleeding disorder called hemophilia. But in much lower doses, significantly lower doses, large clinical studies show that the use of tranexamic acid has improved melasma in 90% of patients, even though they did not respond to traditional treatments for melasma. This is a medication. It needs to be prescribed by a doctor, and we need to make sure that tranexamic acid is safe for you. It is also used in conjunction with topical creams like hydroquinone, which I discussed earlier. Two things I want you to remember. One, always wear UV protection. The sun is our enemy. It causes 80% of our aging changes. Remember also that the treatment depends on the type and severity of your pigmentation. The deeper the pigment, the more difficult it is to treat. Melasma in particular is unpredictable. Often what works for one person doesn't work for another, and it will require a combination of different forms of treatments. If you want to learn more about the pigmentation that you may be seeing on your face, please don't hesitate to reach out to us. I'm Dr. Sylvia, and I am here for you.